Today we're going to do an application of the Ortho Innovations knee orthosis. Today's application is for whether it is a prefab brace or a custom orthosis. The application that we're going to be doing today is for a patient that is in an extension contracture and we want to gain flexion. So the first thing that we want to do is just loosen up our proximal straps, our distal strap, since we are doing an extension contracture and we want to gain flexion, the brace is going to go posterior. So we want to now mimic the contracture to the brace. So we're going to slide the brace again posterior, and again this is for a custom or a prefab brace. Next, we just want to put our distal and our proximal straps on again. It doesn't make a difference which one we do first. This is just to hold the brace in place while we adjust it. Now, next we need to adjust our middle straps. And first thing we need to do is take one strap first. We'll do the proximal strap. Remove the Velcro from the strap, then remove the strap from the Velcro on the brace. There's Velcro on both sides of the brace. We want to pull up on the strap to make sure that the strap is nice and snug posteriorly on the patient's leg. Keeping the tension on the strap and on the leg, we want to wrap the strap around the brace and reattach to the strap posteriorly. We're going to do the same thing for the proximal strap. Again, remove the Velcro from the strap, the strap from the brace. Again, we have Velcro on both sides of the frame. Pull up on the brace, or up on the strap, keeping the tension on the strap, wrap it around the brace. We want to make sure that our joint of the frame is in line with the joint of our knee as well. Once we have our middle straps adjusted, we can snug up our distal and our proximal straps. Now we need to go ahead and apply the force on the brace to get our flexion. Now the typical protocol is, of course, whatever the physician prescribes. A normal protocol is anywhere from 3 to 5 treatments a day, 25 to 30 minutes per treatment. With this brace, the patient is allowed to wear it at night if they'd rather have a treatment at night. So what we need to do now is that the patient, they need to go ahead and turn the brace so we start getting some flexion. And we want to turn the brace until the patient feels a nice stretch in their flexion. I don't want it to be a painful stretch. I want it to be more like a comfortable nuisance. When the patient reaches that point, they will then back off on the brace a quarter turn and sit there for 5 minutes. At the end of the 5 minutes, the patient then will do another 1 to 2 turns of the brace, or the knobs, making sure that they are always turning the knobs simultaneously. And then they'll sit there for the next 25 minutes. When the longer treatment is in progress, the patient can remove the knobs. There's a strong magnet that keeps the knobs in place of the brace. And you will notice that when there's tension on the brace, there's no way that these knobs can be moved, or the brace will not be able to move. It will retain the shape that we have adjusted it to. The patient can be mobile, but they cannot be weight-bearing on the leg while the brace is on. At the end of the treatment, all the patient needs to do is just release the proximal and distal straps and slide the brace out.